let's talk about hip flexors and hip mobility in pilots for just a second. So in a cockpit, when you're seated, your hip flexors and all these muscle bodies in the leg, the torso section that are crossing and converging, coming together in the hips. They're in a shortened position because of the angle that's in our legs to our torso. So when they're in that shortened position, add in helicopter pilots, smaller aircraft pilots specific, the pedal movements that you have to also induce. So you're in the seated position, but then you're also having to manipulate the pedals. So there's already a constant tension on a shortened muscle body for hours at a time. That's going to create a lot of tension right here in the forward hip area. What is that doing? So we've shortened this front section right here. You'll notice the pelvic tilt that happens forward because this area is so tight. The next thing you'll notice is the lower back section here. So my forward muscles, tendons, ligaments have been shortened here. My lower back has also shortened as well. So the muscle bodies in the back, the spine, the discs in the spinal area have also gained a lot of tension, and that's going to create lower back pain because of the shortened distance between the torso and the leg in the front half of the hips. The reason we need to do hip stretches to lengthen these muscle bodies back out and create that mobility and that range of motion so that we can also reduce the back pain that we experience as well. What is this going to do for our back by stretching out our hips? It's going to create more space within our spinal column, so it creates less pressure on our discs so that we can set our hips back to its proper positioning, lengthen out the muscle bodies where they need to be lengthened, create more mobility and flexibility within our bodies, and create less pressure in these sensitive areas that we are positioning ourselves in very frequently. That is why stretching is so important. So go follow some of my stretching videos. I have hip specific and lower back specific 10-minute stretches. Do one, do two, do three of them. Stack them on top of each other and notice the difference.